These are a certain group of muscles which are actually located in the pelvis, that is the lower part of the abdomen, which extends from the tailbone to the pubic bone. Ideally, to understand better, I would say these are the muscles which are located in between both the hips. So these muscles support the bladder, as well as in females mainly the vagina as well as the anus. So these muscles give support to these structures. So you can actually feel these muscles when you try to stop your urination while you go to a toilet. So these are the group of muscles which are called pelvic floor muscles. Pelvic floor exercises. Commonly we hear the term Kegels. Kegels are nothing but the exercises which we use to strengthen the muscles in the pelvic floor. So the major benefits of these strengthening exercises are mainly to treat the urinary incontinence and also treat the pelvic organ prolapse, especially in the females. Apart from the medications, the surgeries, the lifestyle and the dietary advice which we give to these patients, we also give the advice of pelvic floor training or Kegel exercises to them, especially the patients having bladder issues, bowel issues, and mainly the sexual dysfunctions, pelvic organ prolapse, and patients who are undergone the perineal surgeries or the pelvic surgeries, mainly the males who are undergone prosthetic surgeries. These patients benefit from these muscle training exercises. Especially these are the men's fall into two categories, especially men who are suffering from overactive bladder, where they cannot hold their urine for a long time, where they have urgency to pass urine and they couldn't control. There will be dribbling of urine before going to a bathroom. So for such patients, we advise some medications as well as the Kegels, which bring the control of the sphincter. And in the post-surgical patients, where we remove a prostate for like cancers and all, where radical prostatectomy is being done, for these patients also we advise the Kegel exercises, where it strengthens the urinary sphincter and gets the urine under control. There is no fixed regimen or fixed advice, how duration and all. There is no fixed advice on this. My goal is the pelvic floor training falls into two categories: short training and long training. Short training is nothing but we advise the patient to strengthen or to contract these muscles for 1 or 2 seconds, and in long duration, and in the other regimen where we tell the patient to hold it for more than 5 seconds. So we combine both the short and long contractions. Like the patient had to do at least 10 contractions, of which 5 should be lasting for only 1 or 2 seconds, and the other 5 should be lasting for at least 5 seconds. So in a day, these 10 contractions had to be done for around 3 to 4 times in a day. So by the end of 6 weeks, the patient starts feeling or getting the results out of these exercises. Pelvic floor muscles training is one of the most safest exercises to say. There are no assets, there are no any contraindications, nothing like that. The only thing is they should adopt the proper technique of training. Like whenever they do pelvic training exercises, they should not feel pain in the pelvic muscles which they are training. If they are feeling pain, then they should consult the doctor and get the proper they should get educated the proper technique of training. That's it. And mainly the patients who are getting trained by Kegels, they contract their belly muscles also. That is not advisable. They should keep their belly muscles relaxed. Then only you will get the benefit out of these exercises.